Hey, welcome to the Go-To Physio podcast, episode 68, season 4, episode 18, all on how to improve your patient visit average or improve your therapist patient visit average ethically. Now, the patient visit average, it's a very, very important metric in the Go-To Clinic Head Physio dashboard. And in the past few episodes, we've talked a lot about the value of the Head Physio dashboard. We've talked about some of the other key metrics. But what I want to do today is I want to recap a lot of the other metrics because they're going to influence your patient visit average. So what is your patient visit average? Well, your patient visit average is how many times on average your therapist or yourself will see a patient. So if you had 5 patients in this week and patient 1 you saw for 1 session, patient 2 you saw for 2 sessions, patient 3 had 3 sessions overall, patient 4 had 4 sessions, and patient 5 had 5 sessions, then what we would do is we would add up all of the sessions combined and then just divide it by 5, and then you'll get your average. So again, that's 5 and 4 is 9, plus 3 is 12, plus 2 is 14, plus 1 is 15, divided by 5 is 3. So you would have a patient visit average of 3, okay? So the key thing with the patient visit average is it can be a little bit tricky to calculate, and I've seen a few different people suggest different ways. How we do it in the Go-To Clinic is we look at your last 30 patients outside of 13 weeks, okay? So we go back 13 weeks and we go, right, where was your last 30 new patients? And then we add up all of those sessions and we divide it by 30. Now, why do we do it outside of 13 weeks? Because we are making a reasonable assumption that if a patient came into us within 3 months, they're going to be discharged unless it's something seriously wrong. Now, again, our patient visit average, our standard here for a run-of-the-mill, let's say, private practice, it wants to be about 6+. If you're a clinic that specializes in ACL rehab and that patient's with you for 6 months, then your patient visit average is going to be very different, okay? And it's going to be, it's probably going to need to be looked at outside of the 3-month window. So as always, there needs to be some common sense here specific to your clinic. And that's what we do in the Go-To Clinic Mastermind, is we install a Head Physio dashboard that works specifically to your situation, okay? But again, for the Go-To Clinic standards, I think 6 is pretty reasonable for a lot of private practices. And as I said, it can be up a little bit higher if you so wish, depending on the sector that you work in, okay? So now that we understand what the patient visit average is, well, why is it important? Because we know from if we get 100 patients and your IA rebook rate is, for example, 70%, and then you've got a clinic B who's hitting the standards at 90%, you've got a drop-off rate of 15% versus the other clinics that got a drop-off rate at 8% hitting the clinic standards. What you're usually going to see is that'll correlate, from my experience, with your patient visit average. So if your IA rebook rate is poor, you'll usually see a poor patient visit average as well. If we get your IA rebook rate high, that'll naturally start to increase your patient visit average. And again, we talked a lot about that in the previous episodes. But the other big lever that we can pull there as well is the amount of patients going into packages of care. So again, we have it on the Go-To Clinic Head Physio dashboard. If you do packages, we'd aim for about 50% with that. Now again, if you want to know how to sell packages of care ethically and without being salesy and using all these sales scripts or any of that nonsense, go back a few episodes. We cover that in that episode, a couple back, to show you how to do that ethically. But the beauty is, if you fix the IA rebook rate and you get patients on packages, that'll naturally drop your cancel did not rebook, so your drop-off rate, and it will improve your PVA. And then in the last episode, we talked about dropping the drop-off percentage, how to get that down for the patients that don't take a package of care, and then improving that metric naturally improves your patient visit average, okay? So you can really see that your patient visit average, it's a combination of all of the metrics, okay? So within Clinic A here, getting their IA rebook sorted, getting their package of conversion sorted, and then improving their drop-off percentage, it's not uncommon for a clinic to double their patient visit average. And those 3 levers alone, okay, getting your IA rebook from 70 to 90, your PVA, your patient visit average from 3 to 6, and then getting your drop-off percentage down, which will naturally happen anyway, because the patient visit average and drop-off tend to work together, getting that to 8%, it's a 2.3% growth in Clinic B versus Clinic A without any new patients. So for 100 patients, Clinic A with the 70% book with a drop-off rate of 15% and a PV of 3, per 100 patients at an average order value of 50 quid, they make £14,000. They generate £14,000. And that's not profit, by the way. That's just they've generated. Okay, by the time you pay your therapist wages and all of that, there's not a lot of profit left, okay, and your admin. Clinic B, per 100 patients, they had an IA rebook rate. They're hitting clinical standards of 90%. Patient visit average, that's gone up to 6 with a drop-off rate of 8%. They've generated £32,000 per that 100 patients compared to Clinic A's 14,000. So they've generated an additional £18,000, okay, per 100 patients. And the number of appointments that Clinic A had with that IA rebook of 70% and a drop-off at 15% and a patient visit average of 3 was 280 total appointments. 280. Clinic B, getting your patient visit average from 3 to 6, IA is up to 90% and drop-off rate down to 8%. There's a total appointment of 640. 640 appointments versus 280 for the same 100 patients. So you 53 patients completing Clinic A, 83 on Clinic B. There's a big difference there. The amount of patients that actually got discharged, big difference, okay, versus the patients that dropped off without achieving their patient value outcomes. There's a big difference to helping people. There's a big difference to ethical profit. There's a big difference to your ability to grow this business without constantly needing new patients that Clinic A needs in order to even survive. And as I said, if you've got a clinic and you've got a patient visit average of 3 and your IA rebooks is 70%-ish and you've got a drop-off percentage of 15%, and that could even be higher, and you're paying admin staff and you're paying therapist wages and everyone wants a pay increase every year, it's very hard to make money, okay? Ultimately, there as well, I would be very skeptical, most importantly, that the patient has actually achieved their outcomes. And when you adopt the culture of patient value outcomes, that's when you can take the emotional decision making. Has this patient actually achieved these things? And if they haven't, then why are they being discharged? So again, the last few episodes will talk a lot about those other metrics, but today we want to talk about the patient visit average in total. So the patient visit average, you can see, it's encompassing essentially what's going to influence your patient average output number is everything from the very first session all the way to the final session, okay? Because everything matters for the patient visit average, whereas the IA rebook percentage, you're mainly concerned with the first session. So this is where the go-to clinic patient journey 6 stages become really important, that we need all of them, okay? So the first thing to improve our patient visit average, which we spent a lot of time talking about, so I'm not going to go high level or I'm not going to go deep into it. You can go back and review the last few episodes. We need a patient to buy into the treatment plan, okay? If they're not buying into the treatment plan because either a clinical issue, clinical overwhelm with the therapist, or they just don't have the tools to confidently explain the problem, solution and plan to the patient, or they're not actually explaining a treatment plan, then we need to fix that. Clinically, we need the patient to feel the difference in the first session. Use the go-to clinic hub outcome protocol. Here's my hands-on techniques, here's my rehab techniques to achieve that outcome. Very often at this stage, the treatment is misaligned to what the patient defines as a value outcome. We need the patient to rebook and turn up to the next session. If they don't do that after the first session, your patient visit average is going to be on the floor, okay? Again, what makes them turn up to the next session? They've made progress in the first session, we're assuming. Now, what have we prescribed between the first session and the second session to continue the progress so that they can continue to feel a difference? By stage 4, they've hit the first 3 milestones in the first 3 sessions. If they haven't hit the first 3 patient-defined value outcomes in the first 3 sessions, that's a patient that's not making progress in my eyes. So they're not feeling the progress, so they're at a higher risk of dropping off. So this is where a high will therapist is critical to ask for help. If we don't have that patient hitting those 3 sessions within the first 3 sessions, that I would suggest that that's a higher risk patient. So rather than being reactive and trying to put all the resources into our admin team to try get these cancelled and not rebooks that didn't receive value in the first place, or perceived value I should say, back, be proactive and put some time and energy into identifying these patients, fix the issues clinically or systematically in the business to support your therapists and your in-service trainers and use that time to generate more revenue, but most importantly, to actually keep patients progressing. So we need to hit the first 3 milestones within the first 3 sessions. And then the key levers, if we've done all of that, is your therapist having the knowledge to bridge the gap from low to high level. So we can audit very quickly stages 1 to 4 in the patient in the therapist notes of how well aligned the therapist was at extracting the value from the patient, their hands-on treatment and their rehab, how aligned that was to the outcomes of the patient. In stage 5, we can clearly see, has the therapist got a clear plan for the next session with the patient? So that's the thing I'm looking for in the patient notes. At that point is, even when the pain's eased, is there a clear plan in the next session, and has that been communicated to the patient so that they can see they've made progress, but there's more progress to be made. And then stage 6 is, have we actually exposed them to the worst case scenarios and achieved the definition of success that they asked us for in the first session? So if we do all of those things, then the patient visit average essentially will take care of itself. So on the right side of our patient storyboard, our clinical tool, our intellectual property here in the GoToClinic Mastermind, a mentorship that we use, the patient V. On the right hand side, it's all about the outcomes. So you'll be able to instantly see from your therapist V if they have actually extracted value versus another therapist who thinks that the patient values wall drills and press ups, okay? Unless they want to do them in the gym, and that's an absolute burning desire, they have not been able to extract what the patient truly values. And they haven't been able to align and communicate their treatment plan and the context for the rehab to that value outcome, okay? Because if the patient doesn't perceive value, then essentially no value has been delivered, okay? It's harsh, but it's true. So that's where really, with the patient visit average, it could be a combination of all 6 stages. And that's why I've left this last out of all of the standards in the GoToClinic dashboard to talk about, because if you want to improve your patient visit average, we need to use our head physio dashboard to see what the other metrics are and where's the opportunities. Because if your IA rebook rate is below 90% and it's on the floor of 50-60%, then there's no point focusing on stage 4, 5 and 6, because the IA rebook rate is the problem. It's a stage 1 problem of something that isn't happening there. Okay, we fix that. Naturally, that's going to increase the patient visit average. We then improve your ability to convert patients to packages of care ethically. That within itself will double your patient visit average for a lot of clinics. And it'll make a massive difference to the efficiency of the business. It'll give the therapist time to actually deliver the results for the patient then, okay? Then it's just a case of the other 50% of patients who didn't take a package of care. They're the priority patients then to make sure that they keep progressing, because out of your 100 patients that come in, if 50 of them take a package, then we're not worried about those patients dropping off now. We've got time to deliver results for those patients. Those patients are bought in. Now all of a sudden it's 50% of 50 people rather than 100 that we're worrying about dropping off. Okay, I hope that makes sense. So that's the value of the packages. Then out of those 50 people, we want to have a clear framework for every session. We want to have a clear plan for every session. We want to make sure the therapist's treatment is aligned with the outcomes and it's clearly communicated what the next step is as well. Okay, so that's your patient visit average. It's not as clean cut as, oh, you just need to do this and it's going to fix it. That's where we need to understand the numbers. We need to correlate those to the 6 stages of what is happening or what isn't happening. And then we need your patient value outcomes to actually be able to figure out through the clinic notes how aligned your therapist treatment was with the actual outcomes that the patient wanted. Because the patient visit average issue could be that your therapist just doesn't know what the patient value outcomes are. And you fix that, and then all of a sudden, a lot of things click into place. And that's very, very common thing that we can solve very quickly with therapists, okay? So your patient visit average is really your profit engine metric, okay? If you have got a low patient visit average at 3, you've got admin team, your therapists are on very good wages, your rent is over 5% compared to the revenue that you're bringing in, it's going to be very, very hard to have a profitable business, okay? It's going to be very hard to pay money for Google ads and Facebook ads and get a positive return on it, okay? It's going to be very hard to constantly scale without constantly needing more and more new patients, okay? That is a recipe for a stressed, overworked therapist that's taken all of the risk, and your therapists and your staff are probably earning more money than you, Okay, and again, I don't say that to judge or to elicit any pain for you. I just do it to literally tell you that you need to change something, okay? Whereas you change that to a PV of 6, all of a sudden you're not constantly worrying about new patients because you're maximizing the return on investment ethically with these patients. On the other side of it as well, you're getting better results, which is reviews and referrals, makes your marketing easier. Then you can afford to spend more money on your marketing. Then you get a better return on investment. And ideally, if you hit your go-to clinic standards, you can outspend the competition on your marketing. You can afford to spend more money, and that's how you win. Okay? So again, you can double your profits without needing new patients by improving that patient visit average. But that patient visit average, as I said, is a combination of everything. But it's the true metric really of your profit engine. And if your patient visit average is 2 to 3, your profit engine is suboptimal. Okay, we want to get that at least to a 6, depending, as I said, it could even be higher depending on the sector you are in. Okay, if you want to fix it, you need to know your numbers, you need to understand the 6 stages of the patient journey, and you need to have the patient value outcomes, okay? We can install all this very, very quickly for you. If you're a multi-therapist clinic owner, the go-to clinic mastermind, we'll train your team, do all the heavy lifting, give them the skills knowledge that they really need in private practice while helping you install all the systems that you need. Very, very easy to do if you have the shortcuts and the cheat sheets that we've got for you, and we'll help you gain freedom, okay? We'll transform these numbers so that you can ultimately have a profitable business that has happy patients, high profits, happy staff, okay, and ultimately you with the freedom. If you're not interested in the business systems and all that, you just want your clinicians trained, that's what the Train My Clinician pathway is for you. We'll take your therapist numbers. If you don't know them, don't panic. We'll give you cheat sheets to extract them very, very quickly and easily, and we'll use those numbers to transform your therapists into skilled private practice clinicians that can actually drive the profit ethically in your practice. If you're a solo clinic owner, we've got the go-to clinic mentorship for you. Or if you're a therapist working for someone else in private practice, we've got the go-to therapist mentorship for you. Okay, so again, if you understand that the language of high performance is numbers and you want to get better clinically, you want to achieve that clinical excellence, then the go-to therapist mentorship will help therapists working for someone else in private practice. We also have a lot of professional sport physios in there as well. Okay, so that's it for this week. I hope you enjoyed this series on improving your head physio dashboards. As I said, the potential here for clinics is huge. You just need to know your numbers. You need to have systems and structures and processes in place. And then you just need to know what the key inputs are that's going to change the output. And it's very, very easy when you have all of these things. I've done the hard work. I've had to figure this out myself. I've had to create these frameworks and structures to get everything to match together, to use it as a diagnostic board essentially for myself. But I've done this for myself now over the last 5+ years in our clinic. We've been doing it with clinics all over the world, and I can see very, very quickly based on the numbers now what is happening or what isn't happening in the treatment room. You take that and then you look at the clinic notes, and then you get a very, very clear picture of where you need to go next. Okay, so that's it for this week. I'll see you next week. Thanks for tuning in to this week's show. I hope you enjoyed it. Now, if you'd like a free copy of my Head Physio Systems 6-step checklist that I use to personally audit my own therapists to make sure that they can keep patients progressing even when the pain is eased, so that we can ethically increase our patient numbers, our revenues and referrals, head over to www.thegotophysio.com/checklist and I'll get that sent straight over to you. That's it for this week. I'll see you in next week's show.